Hello everyone, welcome to my channel, Dr. XYZ Pathology Pearls. Today we shall discuss the difference between healing by primary union or first intention and healing by secondary union or second intention. This is also a very important topic from exam point of view. The first point is definition. Primary union means healing of a clean, uninfected, surgically incised wound with edges closely approximated, whereas secondary union is healing of a large gaping infected or contaminated wound where edges cannot be approximated. Second, infection. Primary union is uninfected, secondary union is infected. Margins. The margins here are surgical, that is clean, whereas in case of secondary union, the margins are irregular. Cleanliness. In primary union, the wound is clean. In secondary union, the wound is unclean. In case of primary union, sutures are used. In secondary union, sutures are not used. Healing. In case of primary union, there is scanty granulation tissue. In case of secondary union, there is exuberant granulation tissue which fills the gap. Now, the healing time is faster in primary union, whereas it is slow in secondary union. Healing process occurs in 4 stages: hemostasis, inflammation, proliferation, remodeling. Whereas in secondary union, though healing takes in the same 4 stages, but there is more intense inflammation and granulation tissue. Inflammation is mild in primary union and severe in secondary union. There is minimal fibrosis or scar in primary union, whereas the scar in secondary union is large. Epithelialization is rapid in primary union, occurring within 24 to 48 hours, whereas it is slow in secondary union. Now, granulation tissue is minimal in primary union, whereas it is abundant, filling the gap in secondary union. Tissue necrosis is minimal in primary union, whereas it is considerable in secondary union. Wound contraction is negligible here. In secondary union, it is prominent because of the myofibroblasts which pull the edges together. Now, the outcome in primary union, it is a neat linear scar. In secondary union, it is a contracted irregular wound. Complications are rare in primary union, and sometimes epidermal or inclusion cyst can occur, whereas complications are more common in secondary union, like infection, delayed healing, keloid formation. Now, the examples of primary union will be surgical incision like cesarean section, appendectomy, whereas the examples of secondary union are ulcers, large traumatic wounds, abscess, and burns. So with this, we finished the difference between primary union and secondary union. Let's quickly revise the points. First point is definition, then infection, margins, cleanliness, sutures, healing time, healing process, inflammation, fibrosis or scar, epithelialization. Then we have granulation tissue, tissue necrosis, wound contraction, outcome, complications, and examples. Now, I will give you an important table which is very important for you to remember. Now, wound healing by primary union or first intention. In this, there is the clean surgical wound, minimal tissue loss, mild inflammation, little granulation tissue, rapid epithelialization, minimal scar, and fast healing. In secondary union or second intention, there will be large irregular wound, tissue loss, gaping edges, severe inflammation, abundant granulation tissue, slow epithelialization, large scar, wound contraction, slow healing, and complications. With this, we finish the difference between primary union and secondary union. If you like my channel, please like, share, and subscribe my channel. Also, let me know if you want any important topics to be discussed. Please comment. Thank you for watching. Happy studying. Take good care of yourself.